Bwrda i chi gyd. Good morning to all. It's really great to be here today. Welcome. Thank you so much for joining us at our Accelerated Cluster Development Programme. I understand 350 people have signed up to the event, so that is amazing. Thank you so much for being here. Also would like to thank you so much for your dedication and commitment during the pandemic. The way in which everybody has responded has been truly remarkable, making sure that we've all focused on keeping the people of Wales safe during what has been a very demanding 23 months. So again, thank you very much. I think we all know that COVID-19 has seen unprecedented challenges for the whole of the health and care system. Responding to the pandemic has meant that primary care has needed to make a number of changes and advances during the last few months, in particular things like remote consultations, both telephone and video, and now a significant feature of how patients access day-to-day services across primary care. I know Welsh Government was able to provide some investment to support that, which was great, but clearly investment is one thing, but all the work that was done to ensure that that was such a success and became adopted in Wales was really important. So again, thank you to everybody who's contributed to that and made those changes not only possible, but actually become part of the way in which we work in our system now. So thanks. I think also the pandemic has brought much closer working between the public and our community services. I think this close working was brought out of necessity during the pandemic. But I do think this time now for us to think about all the things that we did do during the pandemic and what we might want to keep as part of the way we work as we bring our health, social care and our community services even closer together. I think that we must ensure that the joint planning is effective and that actually this leads to seamless delivery of care, because if it's not seamless, then clearly that's not so good for both our patients and our communities, but also our staff as well. So during the pandemic, local authorities, health services and the third sector all took rapid collective action to ensure that our communities and people could access the care that they needed and the support they needed to stay well at home. Things like shopping services, befriending services, community prescription collections, community transport, and support for older people to use technology so that they could connect with their loved ones were all very simple, low cost, yet really quite critical in terms of keeping people supported at home and well and staying well. It's really important now that we now think about how we can embed some of that moving forward. I think our systems have been under huge pressure, and the interdependency between health and care has become really so clear if it wasn't before. But making sure we think about how we can develop integrated whole system approaches to those collective challenges is now part of what we need to do going forward. I think we've all known that the pandemic has truly exposed some of the fragility in social care. I think there's been a focus on low pay, difficult working conditions, terms and conditions, and the huge challenges in staff recruitment and retention, which are now all receiving focus and attention, which is really positive. But we all know without the right care and support services in our community, that more people will find themselves in need of health services, will find themselves in need of hospital admission, and may experience delays in terms of support at home if our care system isn't effective and able to respond to needs. So I'm really grateful for everybody's contribution to the agenda today. Really excited about what the Accelerated Cluster Development Programme offers. I think, you know, across Wales now, it's really vital that at cluster, local and regional level, we take every opportunity to find and work with new partners and with new solutions to help people stay well and stay close to home as possible. So really great opportunity. I think the Regional Integration Fund now being made available through the regional partnership boards and capital funds to support the development of integrated health and social care hubs can also provide a catalyst to bring some of those services closer together to make our services more seamless, and to maybe even better integrate our offer to our citizens and our communities. I think the pandemic has also shone a light on inequalities in health. I think as well that the clusters offer a really effective mechanism to understand the specific needs of individuals and of communities, but making sure we use that understanding and that knowledge to ensure our interventions are directed to those who need it, that our funding is directed into the right place, into the right services, and that we are able to develop our workforce and community resources to respond to those needs. The programme for government quite vitally focuses on right care, right professional service as close to home as possible. And I think there's a really important opportunity here for the Accelerated Cluster Development programme to really galvanise support, activity and response to some of those inequalities that we have all seen. So I'm not going to say too much more about the Accelerated Cluster Development. I know Alan Laurie is going to speak to you about that in some detail, as well as Sue Morgan, who's going to explain how the programme and development work aligns with the strategic programme for primary care. Throughout the day, there'll be the opportunity to hear from people across the care system, voices from both primary care and social care on what this means, as well as from my colleagues in Welsh Government, Alex Slade and Albert Heaney. So it just falls to me to say, have a good day, enjoy the programme, huge opportunity here. I'm very excited about the opportunity Accelerated Cluster Development will bring to our care system. Diolch yn fawr I chi gyd. Thank you for being here. I'm now going to hand over to the Minister for Health and Social Services, Eluned Morgan, for her opening address. Diolch yn fawr iawn. Thank you very much.